Commissioner Sommerman has been here before, and he's a friend of our club, so I'll let him start with his presentation.
Yay!
As you all know, I prefer conversation over presentation. So if at any time you have a question, just speak right up and I'll be glad to answer it for you. So let me tell you why Parkland sent me to talk about this issue. The reason why is, first of all, the county government is the creator of Parkland Hospital in many regards. We, the commissioners, appoint people to the board that governs Parkland. We, the county commissioners, approve the budget for Parkland. So we have to have intimate familiarity with how the dollars that flow in and out and how it's associated with your tax dollars with it. And we also have to approve the tax rate for Parkland. So again, we have to be familiar with the dollars in and dollars out. One of the things that I was involved with is trying to do the analysis about how the big ugly bill would affect Parkland and your health. So before I begin, let me tell you a little bit about Parkland. I know you all know a little bit about it, but let me be clear. Parkland will treat you without dollars. They need your dollars, and if you have dollars, they will take it. And what I mean by that is if you have health insurance, Medicaid, Medicare, whatever the benefit may be, they take those dollars and put it to good use. There is a gap between the amount of dollars that they take in and the amount of dollars they expend because they treat the uninsured. Straight up and down, that's what they do. They treat undocumented. They treat folks who don't have insurance. They treat the elderly, the young, everybody you could possibly imagine. They'll even treat if you are not from Dallas County. Let me tell you why that matters. So if you are an uninsured individual and you are from Frisco and you come down to Parkland Hospital, you will be treated, period. If you are uninsured, who pays for that Collin County individual is you, the Dallas County taxpayer. So there's this big Republican county up there that boasts about its tax rate, that boasts that it doesn't have a hospital, that says, we are not going to do that. And when we, Dallas County, presents a bill to Collin County and says, hey, pay us, they do not pay us. And then they talk about how great Collin County is because of its low tax rate, because this blue county is taking care of those red county citizens. That's straight up and down.
Boo!
Yeah. And I assure you, I'm fighting that. I mean, litigation, and there's a chance at us being actually able to get legislation, even in the red legislature. There's a reason why. There are a number of counties that are in a similar situation. Harris County, giant county, right? They are in that situation. And you think, okay, there's another blue one. Well, what about Brownwood, for example? Brownwood has a small clinic in it. And even the smaller counties that are around it, they treat those individuals and they're not paid for it. And so as a result, a lot of these smaller rural counties are sensitive to the notion that their county is the one that's being responsible, and the surrounding red counties are not being responsible from a healthcare standpoint. So I think it's possible to push back on this, especially given that the big ugly bill is going to destroy rural hospitals. I mean, it's just, so they're going to have to find resources elsewhere, and as a result, I think that type of legislation could pass. So that's a little bit about Parkland. Does anybody have any questions about Parkland before I tee it up? Ready? Moving on. The big ugly bill is so terrible and so awful that we have to put up puppies before we begin, just to make sure that I didn't ruin your meal before I start talking about it. Okay. So I think you probably know, you all know are politically active, right? and you all are aware of what's going on in the world, but let me give you a brief understanding, okay? The Big Ugly Bill was signed on July 4th. There was a flyover. It didn't coordinate too well. We all know about that. It was a very narrowly passed piece of legislation, straight up and down on party lines, with a little bit of the R's coming our way on this particular. So by the numbers, it's approximately $1 trillion in Medicaid cuts over an extended period of time, over a 10-year window of time. There are 11.8 million people who will be projected to lose their Medicaid as a result of this bill. And there are an additional 5.1 million people who will lose coverage from other problems that this bill has created. That's a lot of folks. Okay? Let's go to the next one. So if we take a look at who are the most uninsured states in the United States, you can see here where we wind up. We are number 5 as to the most uninsured anywhere. So you can see how if we kick even more people off of any type of health care, it will have a dramatic impact upon you and also upon Parkland. I'm going to get to a slide eventually that tells you how it hurts you directly. I'm not talking about because you're caring for someone who's on Medicaid. I'm talking about you. All right? Let's go next slide. All right, so let's talk about when things happen. All right? The big, beautiful bill, for the most part, doesn't take a lot of teeth to it. There's some teeth to it before we get to midterm elections. And then, as soon as midterm elections are over, boom, they go into effect. Especially work requirements, increased frequency of redeterminations, and limits to retroactive eligibility. I'll get into all of those in just a minute. So you can see that for now, it's probably no big deal right up until we get to midterms, because they don't want them to be felt until after the midterms. And then all kinds of terrible, awful things come to the state cascading down. Get it done? Thanks. All right, 34% of people in Texas will not receive mental health care, which will directly affect you. Okay? Because we are cutting off Medicaid, Medicare, because we are going to have to increase the cost of medical care, a bunch of folks will not be receiving mental health care. Now, what does that mean? That means crime will happen to you. That means homelessness will increase significantly.
Hey, Andy, I work in the criminal system with a lot of people who should qualify for Medicaid, but thanks to the legislature, we don't have that kind of Medicaid. But mental health services are available for basically everybody because we go through the North Texas Behavioral Health System. And NIPA will this funding affect that?
No, it will not affect NIPA or MetroCare. By the way, both of those are county-like entities, and as a result, we're going to make sure that they're kept. I'm going to say this, you're going to hear this again from me. What has happened to us is the county has become the fire line. That's where we are. County is your fire line. The United States government has turned its back on every one of you, period, end of story. Then the state has also, and likewise, refused to step in to that breach in any way, shape, or form, and will probably pull back services as well. And that leaves you the next level down, and that's the county. And we have become the fire line of services. All right, good. But let me be clear. Let me go back to your point. Yes, NEPA and MetroCare is still there, but lots of people receive mental health care as a result of insurance and Medicaid and Medicare. They are getting it paid for. They like the provider that they're getting. Because we are kicking so many people off, it will increase the rate of mental illness in this county, and that will directly impact you. You will see more people on the street in the form of homelessness, and you're going to see more crime, period, end of story. Okay? Not good. In November of 2024, undocumented immigrants visited Texas hospitals more than 31,000 times. Texas hospitals incurred $121 million worth of costs. As you can imagine, the healthcare systems that might have been a net for various undocumented workers who perhaps might have been receiving health care of some form or fashion through an employer are now being forced off those systems and onto the burden of Parkland Hospital and John Peter Smith Hospital, our neighbor. Anybody got any questions on that? Moving on. All right, good. This will affect hospitals in two ways. First of all, there's going to be more uninsured. Because there's more uninsured, that means more people coming to Parkland as a result of not being able to pay it. That affects you directly because you pay for Parkland through the taxes, especially associated with the uninsured. So as a result, it forces costs into Parkland that they currently do not have. Anybody got any questions on that? It's probably estimated that we're going to see an additional cost of maybe as much as 25% to Parkland as a result of that. Okay? All right. This will add somewhere between $75 million and $140 million to Parkland. Big budget. And, you know, the only people that can make that up, taxpayers, once again. Okay?
I have a question about the cost. Do they have a sliding scale of payments out of pocket for people who do not have insurance? Or do they keep documentation on that?
Yes, is the answer. And it goes like this. They do present you with a bill. I mean, if you are uninsured, you get a bill, right? You can talk to them about a payment plan. They will be willing to enter into a payment plan with you at Parkland if you are uninsured, and you can pay something along those lines. But if the bill is presented and it's unpaid, they're not going to put you in jail. They're not. Yeah.
My late husband, who passed away 6 years ago, was a physician at Parkland and UT Southwestern, and he actually founded the Women's Health Center at Parkland Hospital. He named that, and that was his legacy to the people. But the women that was brought in there was just pretty.
It is, isn't it? Yeah. And Parkland's one of the biggest maternal centers that there are in the whole United States and in the world. At one point in time, there were more babies born at Parkland than any other hospital in the United States. I can't tell you if that stat's true today, but it's close.
I think the population has gone down
A little bit, yeah.
You know, but I've lost track since he passed away.
Yeah, right. Okay, so let's talk about cuts to Medicaid in the marketplace, all right? All right, now I want to put this picture in your head, okay? Eventually there's going to be this requirement from Medicaid that you work in order to be on Medicaid. This is just nonsense. It's absolutely crazy. But there's going to be a requirement that you work. Now you can do it by enrolling in education programs or community service. You're going to have to prove it though. Why are they doing this? And the answer is, well, you see, we really didn't cut it. What we did is we just forced people to come and show their work. Well, can you imagine the bureaucracy that's associated with that after Elon Musk has gone through with Doge and just put everybody who's going to be reviewing those documents? I mean, the answer is you just cut people off with Medicaid is the way that works. All right, now let's talk about that from the perspective of you who have health insurance, okay? I'm on United Healthcare, okay? I'm on United Healthcare and I go to Baylor. I'm not even going to Parkland Hospital. Does this affect my prices? Yes. And I'll tell you how it affects my prices. So there I am at Baylor Hospital, and Baylor Hospital